right, so this is Asim. I'm the co-founder and CEO of Give Asia, which is a charity fundraising platform. I'm also the co-founder of Giviki, which is a platform which powers donations and fundraisings for websites across Asia as well globally. Today, I'm very honored to have with me Benjamin William, who's heading Singapore Red Cross, and also Prakash Menon, who's looking after the community resilience efforts at Singapore Red Cross. Thank you very much to all the attendees who are here with us to understand more about Singapore Red Cross Society's intervention and response to this COVID-19 outbreak that we all find ourselves amidst. So without further ado, I would like to open the floor to Benjamin William to maybe share about your journey and how did you get started with working with Singapore Red Cross.
Thank you very much, Asim, and giving me the privilege to be part of this webinar. I've been a part of Singapore Red Cross for the last 9 years. So after spending 30 years in the Ministry of Foreign Affairs in the Singapore Civil Service. When I first joined the Singapore Red Cross, it was supposed to be a temporary journey of about a year or two. But after joining the Red Cross and more broadly the social service sector in Singapore, I realized that the needs are so great that many of the needs go unmet or even unknown to a large proportion of the public. I found that the work here was so meaningful, reaching out to the vulnerable, and I decided to stay on. And what was supposed to be a 2-year journey has now become almost a 10-year journey and probably many more years to go.
Great. And if I may ask Prakash to share your journey with Singapore Red Cross.
Hi, good afternoon, Asim. Actually, for me, it's a little bit more about a calling. I think I've been in this sector for about 20 years now. Been mostly with the public service. And for me, it's really just about helping the people, the vulnerable people in Singapore. I'm very much into helping the local people. You know, I always feel that there's a lot of gaps on the ground, and while the government is doing their best to help the people, I think groups like us can do a lot more. So I think Singapore Red Cross I've been here for close to 4 years now. I think a very satisfying job, a very good place to work with, work for actually, and really not just helping the people, but I think we've got a very good group of volunteers also, you know, to help us reach out to the people. I think that's what we're all here for. Thank you.
Yeah. Prakash, since you are in charge of community resilience and working on the ground, could you share with us maybe some story or share with us what are some of the situations that the vulnerable are facing right now in Singapore due to COVID-19 outbreak?
Sure. I think a very unfortunate thing that has happened to not just Singapore, I think to the world, and we're all trying to grapple with this right now. But for us, I think in Singapore, I mean, the good thing is that we've got a lot of good support from the government and from a lot of organizations on the ground. I think some of the things that people are facing, for the elderly especially, it's isolation, right? A lot of them now, you see, we have a lot of befrienders who used to go to and visit them, but now with the circuit breaker and all that, they are stuck. So they also have been told as much as possible not to visit them, but to make social calls. So that will create more isolation for them. And I think for families, you know, with this situation, I think a lot of them probably have lost their jobs. Some of them have lost their jobs. Some of them have been asked to take no paid leave or leave of absence, whatever it is. But I think people are very worried. There's a lot of anxiety amongst the vulnerable groups. And I think really that's where organizations like Red Cross and like-minded organizations that can come and help these people. Right? Yeah.
Could you also share, Benjamin, what are some of the programs that Red Cross is running right now to help the vulnerable?
Okay, Asim, let me quickly introduce what Singapore Red Cross is doing. But before I go into the program and what we are doing, particularly for the COVID-19 situation, I want to send out an important message. And that important message is about blood donation. Singapore Red Cross is the national blood donor recruiter. And uh, even under these circuit breaker conditions, the need for blood continues. And we need people who are healthy and able to come forward to continue to donate blood. Because the need for blood continues, there will be still emergency operations where blood is needed. And therefore, we want to make an appeal to all of you out there who are healthy, who are able. Don't be afraid. There are all the precautions needed taken at the blood banks. We need you to come forward to donate blood. So thank you very much in advance, and we know that many of you will respond. Now, if Asim, if you agree, then I can go on to talk a bit about what we are doing at Singapore Red Cross. So many of the members of public think of Singapore Red Cross only as responding to disasters and work abroad. But a key portion of the work that we do is in Singapore. So let me share with you quickly what we do and then how that translates to what we are doing for COVID-19. So we have an umbrella of services that we run for the local vulnerable: family life aid, transport aid, community first aid, health aid, and elder aid. Let me just quickly explain each. Next slide, please. So under family life aid, we are reaching out to households which are challenged to provide them with a regular package of provisions. Many of these households are headed by grandparents taking care of grandchildren where the parents are missing. Likewise, there are single parent families who are working hard to make ends meet. So we provide them with packages of food and other provisions on a daily basis. Next. Now, the family life aid was expanded to include mentoring and taking care of children. Why the rationale? As we worked with these families that we provided our provisions every month, we realized that many of them had children and school-going children who were neglected or who didn't receive the full attention they should be. And therefore, we have now extended this Young Hearts program to mentor, to tutor children which come from vulnerable families. Next. Another program that the Singapore Red Cross runs is the transport aid. We are not an ambulance service. Transport aid is essentially there to bring the elderly and the disabled, especially from lower income families, for their essential healthcare services, to medical treatments, rehabilitation, day activity center, or even dialysis. Now, there are commercially available services, but these are very expensive, and we try to make this affordable and accessible to vulnerable families. We expanded it to include medical escort. Now, many people need to keep medical appointments, but they don't have anyone to send them for these medical appointments. And so transport aid includes a medical escort service where our volunteers will bring people for their medical medical appointments and bring them home. Next slide, please. Then we have community first aid, which is, we believe in Singapore Red Cross that everyone in Singapore should be first aid trained. You never know what kind of emergency you may be faced with. And I think this COVID-19 situation has highlighted the fact that there should be at least one person trained in first aid in every home in Singapore, so that for minor things, you don't have to rush down to the clinic or the hospital and be more vulnerable. So I want to take this opportunity to urge people to, be prepared, learn first aid so that you're able to protect yourself and your loved ones around you. We also provide first aid services in the parks and recreation areas and for national events like National Day and Istana open houses. We are also participant in the disaster management exercises to prepare Singapore for disasters, if any were to take place. Next slide, please. Recently, we started this program called Community Health on Wheels, reaching out to vulnerable seniors who find it difficult to leave their homes, to migrant workers, to foreign domestic workers. Basically, we provide ancillary health services like health check, health education, psychosocial support. And these are done together with our volunteers from nurses, allied health professionals, and social workers. At a time like this, again, such a service, the importance of such a service is highlighted with the condition of so many migrant workers living together, having so many needs, both physical and psychosocial. Next. A year or two ago, we started home monitoring. One of the major challenges in Singapore is the elderly living alone. As Singapore faces this challenge of an aging population, more and more elderly persons are living alone. And now we have this service called Home, which is a 24-hour monitoring service, taking care of seniors living alone, post-surgery patients, persons with disability. We monitor their movement, not by closed-circuit television, because that would invade their privacy, but by motion detectors. And our volunteers are ready to respond on a 24-hour basis. And all our volunteers are trained in basic first aid, in psychosocial support, and they will provide a listening ear to anyone who needs it. Next. We also have LifeAid, which is basically reaching out to the elderly. One of the big problems that the elderly face is loneliness. So we have a fairly extensive befriending service where our volunteers reach out, keep in touch, and make sure that people who are living alone are okay. And when they have needs, we are there to help them take care of it. Next. So I want to then go on to the local services and how it relates to COVID-19. So as we come to this period, and especially since yesterday when we have started or 2 days ago when we started the circuit breaker measures, we need to continue our critical services like the befriending service, the transporter service to bring people to their urgent and important medical appointments, the home monitoring so that if anybody has a need, there are still people who are able to respond. And I already mentioned the blood donor recruitment. These are critical services that we run, which we will have to continue to maintain even during circuit breaker period. And we are reaching out to volunteer. We need resources to ensure that these services are not broken. Next. But at the same time, we want to enhance what we are doing. And therefore, we want to provide outreach services to our beneficiaries who are affected by the COVID-19 outbreak. We need coordination. We need the distribution of essential food vouchers. We cannot not send the food vouchers to these families because especially at this time, they need the food vouchers to get their food and other provisions. So it's a major coordination of logistics and packing. Next. Then we are also providing interim vouchers for those affected, especially the daily wage and time workers who have lost their jobs due to COVID-19. We are providing sanitation kits for our 2,000 volunteers so that they are protected as they reach out to the community. We are also ready to accept referrals from other agencies who are not able to take care of their elderly beneficiaries and vulnerable beneficiaries. We are now looking at the provision of care packages for about 1,000 seniors under our programs. And these care packages could range from about $100 to $250, each customized for the person that we are reaching out to because they have different needs. Some may need adult diapers, some may need sanitation kits, some may need food as their main need. But we are trying to make sure that people get what they need during this period, especially if we don't want them going down to the supermarkets. Next. So this is what is going to cost us, the one-time distribution, the 2,000 sanitation kits, and the elderly. We estimate that in the next 3 months, our program will cost us about $770,000. But we'll have to adjust the packages depending on the resources we are able to mobilize. Next. So these are some of the items on the care packages, food, as well as pills, things to take care of their medical needs, hygiene needs, towels, diapers, toothpaste, toothbrush, and then laundry and household items. Next. Now we also understand that there are a lot of people out there who are now psychosocially stressed, psychologically stressed, and we are wanting to provide a listening ear. We have already started to do this with our own beneficiaries, but we are working with the Ministry of Social and Family Affairs as well to provide this at a national level. So our volunteers, our trained volunteers, will be joining the national team to reach out to people who need a listening ear during this critical period. Next. Very quickly, I want to touch on our international response. So in the early stages, we have been providing PPEs to countries that need it. Next. We have provided negative pressure ambulances so that patients can be transported without the threat of the disease going out into the public. Next. Next. We are continuing to work with our partners in China as the country comes out of the COVID-19, as they go back to school, protection for the kids, as well as some support for people wanting to restart their livelihood. Next. Next. Go on to the next slide. Okay. Now at this stage on our international response, we are focused on countries other than China, and we are reaching out to about 16 countries who have reached out to us for their support to handle the COVID-19 situation. And essentially, we are looking at sourcing for PPEs to help them in their combat and their fight against COVID-19. As we help these countries, we realize that in the long run, it will also mean protection and support for Singapore, as Singapore is such an open economy. And I think COVID-19 has taught us that today it is a global community and we have to work together in order to fight COVID-19. Thank you. So to donate, please, there's the QR code there. Please step forward. Thank you.
Thank you, Benjamin, for this very holistic approach and sharing with us. I would like to ask one of the questions from the audience, and I think you touched on how people can be part of the volunteering group for COVID-19 response. Where should they go to sign up as volunteers?
So we have the Singapore Red Cross website, redcross.sg. Please go to the website and it will lead you to where you can sign up for volunteering and other offers for support.
Great.
Redcross.sg.
And I would also, again, share with the attendees that if you have any Q&A, any questions for Benjamin or for Prakash about Red Cross's efforts, please feel free to type them and we will definitely try to answer those. Prakash, would you be able to share a story of a particular beneficiary who has received some assistance from Red Cross during this period? We just want to find out some real story from on the ground.
I think actually even yesterday we we had one of our clients who is actually wheelchair bound. So I think he's isolated also. So he needed some help, and we actually helped him. One of my colleague and a volunteer went down. Basically needed to buy groceries for him. So with this circuit breaker thing, it's a bit difficult, right? Because we've been told as much as possible not to visit anyone. But these are some challenges that we face, and there's quite a lot of isolated elderly who really don't have next of kin. So they actually depend on our befrienders or our team to help them. So luckily this person actually informed us, and I think my team went down to assist to buy some groceries for them. So these are challenges that we will continuously face in this period, and we really just have to make a stand, to really then help these people. I mean, regardless of the circuit breaker, we still need to serve this group of people, because they are the most vulnerable at the moment. They don't have anyone with them, and therefore we just need to go down and serve them. Yeah. So it's one story, actually, a real story that happened just yesterday.
And Benjamin, for you as the CEO of Singapore Red Cross Society, what is your message that is going out to your staff in these challenging times?
So these are very difficult times. We in Singapore Red Cross, we stand for the most vulnerable, and that has been our position all along. And it's a mantra that we learn, it's internalized. But in a situation like this in COVID-19, many situations are very challenging. It challenges our choices, whether we want to put everything on safety and nothing on our beneficiaries, or while we want to help the beneficiaries, what is the balance that we strike? So my message to my staff has been, make sure that you take all the precautions that are needed in order to keep yourself safe, because you need to keep yourself safe in order to be able to help others. Then we need to step up to the plate and help others. We cannot at this time, when it is needed most, disappear from the scene. We cannot be fair weather benefactors. We need to be there when the need is highest. And we are finding that with the beneficiaries that we have who are mainly elderly and disabled, either living alone or living in our home for the disabled, we really need to be there this time. And so all my staff, and I would want to add that many of our volunteers are actually coming forward, taking some risk, calculated risk, to be able to be there for the vulnerable. And I think that's a great effort on our part.
That's saying these two will require a lot of judgment. And I think to that question, there's a question from an attendee. Can you share, Prakash? Can you share some of the measures that are being put in place to ensure that Singapore Red Cross Society volunteers are safe?
Sure. I think the most important thing we do is first we actually provide them with a mask and hand sanitizers, right? So that's important. So we actually encourage them strongly to wear it when they go and visit the client. But what recently we have also done is we have also decided to, when we need to go down to meet a client or to the home, we actually call them to make sure that actually they are not under stay home notice or LOA, because if they're under stay home notice and we cannot go there, that means somebody in the family might have got COVID-19 or due to contact tracing, they've got this notice. So we check all this first before we go down. So we are very careful. We take all the safety measures, and we also take note of the advisories from the government, right? So whatever advisories they give, we also constantly or continuously send it out through our volunteer portal to let all of them know what's happening and what they need to do and all that. I think even yesterday, we sent out one notice to our volunteers. So yes, we take all these measures seriously before we send them out, even for the staff.
Yeah. May I also add that one other thing that we do is to make sure that our volunteers themselves are not in the vulnerable category. So at this time, we have a lot of volunteers who are elderly. So at this time, we will not send out the elderly to the visitation. I give you another example. We give out vouchers, and these vouchers are depended on by our beneficiaries, and some of them may be in stay home order or stay home order. So what we are doing is that we will call them ahead, and we may put the vouchers in the um, post box so that they can pick it up without contact with our volunteers. Of course, normally we would need them to sign off on it, but we are taking this added precaution, and at the same time, we want to make sure that they still get the voucher. So these are some of the measures that we are taking. Yeah,
Yeah, that's great. And I have seen that recently Singapore Red Cross Society has also ramped up the online fundraising efforts, which is probably because you have all these programs that are running and you need to serve your clients, which requires financial funds. So there's a question from the audience, which is essentially about how do you ensure all essential supplies are in place to reach out to the needy during this COVID-19 crisis. And also a question for Prakash that, how are you forecasting or how are you planning for this crisis, which there's an uncertainty how long it's going to last?
Okay. Maybe I go first, and then Prakash, you can pick it up. So I think one of the thing is that whether it's PPEs or it's provisions, there's a difficulty in ensuring supplies. So with regard to supplies that are daily needs, we have reached out to some of the big players in Singapore, and at least one of them have come on board to say that they will support us. Support us in the sense that we will pay for the supplies, and they will ensure that we have the supplies in order to be able to send it to our beneficiaries. Singapore Red Cross has never done mass distribution. We reach out individually to families, to individuals. Our volunteers actually know the beneficiaries we work with. So that is how we ensure that the essential supplies get to the person who really needs it, and the items that the person needs. Now, it is easy for us to distribute Milo to everyone, but sometimes you go to the house of a beneficiary, you might find 10 tins of Milo there. And I'm not kidding. So Singapore Red Cross does it in the sense that actually our volunteers build up a relationship, and this is becoming important in the COVID-19 situation because they are able to pick up the phone even on a daily basis and talk to our beneficiaries. There is always an option. There's a question here on donation. There's always an option to donate to Singapore and to donate internationally. Normally, we are reaching out, and people are very generous when a disaster takes place overseas to donate for the international need. But there are also needs in Singapore. And today I would say that there are many urgent needs in Singapore, and we really appreciate people coming forward to donate for our local services, including during this COVID-19. Of course, we still welcome donations for the international response, but I want to emphasize that there are local needs, and I appeal to Singaporeans to come forward to support the local needs. Prakash, maybe you got something to add.
Yeah. So I think in terms of uncertainty, it's a question that no one can answer right now. But I think what we can do is, that's why we came out with a care package for one, right? So we intend to help for the first 3 months. But I think if we can get enough support from the ground and from partners and from corporate sectors, actually, we want to continue the support at least till end of the year or even beyond to help these people. So that's number one. Number two, I think we want to also provide psychosocial support. So that will be ongoing throughout, not just for COVID, but for all our programs, we do that. So it works both ways. So sometimes our volunteers call them, or sometimes they call our volunteers. A lot of our volunteers have this very personal touch with the clients. So they sometimes even know their handphone numbers and all that. So when sometimes they have problems, they actually call them directly to seek their help, and if the volunteers can solve it, they solve it. Otherwise, they bring it up to us, and then we take actions from there. So that's another thing that we are looking at, psychosocial support. So I think in terms of giving items and all the care packaging, all that, we go directly. So we provide all these packages directly through our volunteers and through the staff also. So all the items will be received by them. It's a big project that we're going to do, and we're just waiting for the circuit breaker to be off, so that we can do this sometime in May, mid May or mid May to late May. It's going to take a while. We're going to need a lot of volunteers to come in, but yeah, this is some of the things we can do during this uncertainty, because we really don't know, right, how long it's going to be. But that's why we need a lot of support from a lot of people out there, to constantly help us so that we can continue help these people. Yeah.
Yeah, go ahead.
Go ahead.
There's a question. Yeah, go ahead.
No, there's a question here on blood supply. Should I take it? Yeah. So we've been talking a lot about vulnerable Singaporeans, and how we need to bring supplies to them and all that. But there's another group of vulnerable Singaporeans, and they are not necessarily financially vulnerable, right? These are vulnerable citizens, Singaporeans and people living in Singapore who may, because of a certain incident or because of their medical condition, need blood supply, need blood transfusion. This does not change whether it's COVID-19 or non-COVID-19 situation. Yes, we can defer all the non-essential operations, which I think most hospitals have already done, but there will still be a need for blood. Now, the question is there a blood shortage? There is no blood shortage as yet. 2 weeks ago or so, we made an appeal out to the public, and public responded beautifully, and our blood stocks are up to the safe level, which is normally we try to keep blood stocks at 6 days availability. There are certain blood that are still below that mark, especially O negative. So if you're O negative, we appeal to you. If you're healthy, you're young, you're able, please come forward to donate blood. O negative. But we also need all the other blood supply to carry on at a safe level. And our concern is that because of COVID-19, some people may think that blood banks are not operational, they are closed, or they may think I should not go out. We want to appeal to all of you out there, especially if you are young, you're healthy, you're energetic, you have no medical problems. Please step forward to donate blood. Go to a blood bank near your place. The blood banks are all open. You can go to the Singapore Red Cross website to see when it is available. Make a call so that your appointment can be made so that you don't have to wait too long, and no bunching. But I want to appeal to you. We need to make sure that our stock of blood remains adequate, safe for blood transfusion needs throughout the COVID-19 and beyond period. Thank you.
Yeah, and I would urge all the attendees to go to redcross.sg, click on donate, and you will be shown different campaigns that Singapore Red Cross Society is currently running, which you can support. And it's not just about donations, it's also about sharing it with your friends and your family members and your colleagues. This is definitely the time to help, because never before in our lifetime, have we faced such an unprecedented, crisis. Another question which I have for Prakash is that in this period, have you seen an increase in number of vulnerable families or individuals that are reaching out to Singapore Red Cross Society requesting for different kinds of assistance?
Yes, it's actually happening already. It's coming. People are calling us and asking for help. I think apart from other agencies referring some of their clients to us for specific helps, I think there are people who are calling us for help, interim help. Some of them are not our clients actually, so they are from the public, and they needed help, and they've come to us. And And the way we're going to help them is also we have this, I think just now Ben mentioned interim help. So we provide them with, after listening, making an assessment, we provide them with interim vouchers, depending on how much help they need. At least we try to start with 1 month first, and depending how big their family is, so we will give accordingly the amount of vouchers, anything from a minimum of $120 and above, right? So, and then from there, we take it on to see what other services that they need and that we can provide. Apart from that, if they have something else that they need and we cannot, we will try to reach out to other agencies to help them. So we'll ensure that the loop for everyone comes to us. Yep.
Yep.
Ben, this is a question for you. Is there any collaboration between Singapore Red Cross Society and MOH at this point?
Yep. So I want to say that with Singapore Red Cross, we are a very unique charity. We are a very unique social service agency, because we work not only with the Ministry of Health, we are also working very closely with the Ministry of Social and Family Development. We also work very closely with the Ministry of Education, because our youth are in the schools. So we are working with a multiple set of agencies, including the Agency for Integrated Care and the National Social Service Council. So
grassroots too.
And the grassroots, yes, right. PA is a very close partner. We work closely with them to ensure that we don't duplicate reaching out to the vulnerable families. So yes, we are working very closely with MOH on several counts. With regard to the services for the elderly, we are working very closely with the Agency for Integrated Care, which is affiliated with the Ministry of Health. And at the same time, we work very closely with the Health Sciences Authority for our blood program. And of course, the Health Sciences Authority is a statutory body under the Ministry of Health. So we are working very closely with the government agencies. And I might add that we are also working very closely with other agencies that are also working in the same sector as us. So we are all working together, not in competition with one another.
That's great to hear. Ben, would you have any message for donors? Because I also see that there are a lot of donors who have stepped up and supported causes, especially the elderly related causes, as well as the COVID response campaign that you recently started. What would you like to say to donors?
So first of all, on behalf of Singapore Red Cross and all our beneficiaries, I want to say a big thank you to all our donors. It has been a tremendous joy, and we are so grateful that donors are stepping forward. We know that many of our donors are themselves challenged at this time, and yet they still step forward to donate because they know that there are people who are more challenged or even more difficult situation than themselves. So we want to thank all our donors, not only those who have donated in the past, but now donating during the COVID-19. We know that many companies are watching their bottom line, but some have still stepped forward with donation in kind or in funds. So we want to say a big thank you to all of them. We want to add to those who are thinking about donating that please consider carefully. We hope that you will step forward. At a time like this, those who are in a vulnerable situation find themselves even more vulnerable. I just want to share a story. I mean, there's a group reaching out to all of us, including Singapore Red Cross, on finding homes for the homeless. In a normal day, life is difficult for the homeless, people who are struggling. They may have children, single parents taking care of children out in the streets. But today with COVID-19 and for them needing to be undercover, they need a place to live. So for the vulnerable, life becomes even more difficult, like our elderly vulnerable. Normally already it's difficult, but now it's even more difficult because if they went down to, say, their neighborhood NTUC, they face the possibility of getting infected because they are very vulnerable. So at this time, we want to urge people who are able to come forward to help us be in a position to help these people. And that is the best that we can do for the society to come together, to work together to overcome this very challenging time. And we really want to thank you ahead in advance of your contribution to this effort.
Thanks for that very meaningful message, Ben. Prakash, what is
Yep.
your message going out to the beneficiaries and clients when you meet them or when you help them? What are you trying to tell them in this challenging time?
I think, Asim, I think very important is a lot of them are very anxious, understandably, you know, in this current situation. I think I just want to tell them that don't worry, we are there with you. We hear you, we know what you're going through, and we are very good people who are with us, there to support you all the way. So anytime you need help, just call us, call your volunteers, your befrienders, or call SRC, and we'll do our utmost best to help you. I'm sure this will pass, you know, just like anything else, it will pass. I want to take this opportunity also to thank all the colleagues of SRC. I think they have our entire SRC is doing their best to help everyone, and also the volunteers. I think a lot of volunteers, as what Ben mentioned, you know, they are stepping forward. They're coming to us. They're asking us what other help can we offer. So people are brave. They're coming forward. They know that they are also in danger, but you know they are still willing to rallying to go forward to go and help these people. And we really appreciate. We want to thank them for it also. But amongst everything, I think most important as we move forward to help people, we also have to take care of ourselves before we can help these people. So please, I just want to tell everyone, you know, just stay safe, you know, look after yourselves and your family before we move forward to help the rest. And for the clients, don't worry, we will always be there for you. That's about it. Thank you.
Thank you.
Thank you so much for this, Ben and Prakash. It has been a really very useful and meaningful discussion. At some point, we had about 50 people dialing in. Right now, we have about 40 people. And I think everyone is in the same mind space, where, as you said, Prakash, you know, we want to be there for our families. At the same time, we want to be there for our clients and for their beneficiaries, because this is one of the most challenging times that they are facing. I would again like to appeal to everyone to consider donating, consider volunteering, consider donating blood, especially if you are O negative. That's right, Ben?
Yes, correct.
Yes, if you are O negative, you definitely want to be you know, considering to donating blood. And yeah, I'm reminded of, you know, this saying that, you know, when you're together, you go further. So if we all continue to do what we are doing, which is standing by each other, helping each other in this vulnerable time, and being kind. I think more than anything in this difficult time, it is about, you know, kindness, and kindness matters. So thank you everyone who asked questions. Thank you everyone for giving your time. With that, I would like to you know, bring this webinar to an end. And once again, I would like to salute you, Benjamin and Prakash, and all the volunteers for, you know, doing what you do at Singapore Red Cross Society and helping the most vulnerable, helping those who are in need. Thank you so much.
Thank you. Thank you very much.
Thank you. Thank you.